Everyone. This is Rahul Joshi, a second year MBBS student from GMC Haldwani, and today we are going to discuss about an MCQ based on immunothrombocytopenia, a chronic ITP. The question says which of the following can be correct set of features in chronic ITP and the treatment drug given or the drug given. Um, for this question, for answering this question, we should know what is ITP, immunothrombocytopenia, chronic the chronic immunothrombocytopenia. This thrombocytopenia means the low platelet count, and immuno means the immune system is working against the platelets. How immune system work against these platelets is the mechanism pathogenesis is that here the B cells produce autoantibodies IgGs IgGs in 80% patients, 80% of patients of immunothrombocytopenia, the IgGs are found in the plasma which are against platelet glycoproteins, platelet glycoproteins. So what happens is this is the platelet and the IgG binds, this is glycoprotein of platelet, binds to this platelet glycoprotein, and this creates a process of opsonization. IgG acts as an opsonin, like the complements act and other things act like this. Antibodies also act, hence the IgG acts as an opsonin, and this process of opsonization leads to the engulfment of platelet by the phagocytes. How? This IgG and this IgG then is recognized by the Fc receptor of the phagocytes, mostly in the spleen. So the platelets are then destroyed by the phagocytes. What happens is then this leads to the low platelet count due to increased destruction of platelets by the phagocytic mechanism. The next thing is the PT, prothrombin and PTT. As you all know, these are the in vitro clotting tests which are which are used to find any disorder of clotting process. But what happens is in isolated thrombocytopenias, like in immunothrombocytopenia also, what happens is that the platelet count is low. Platelet count is low, but the clotting factors are not getting affected in isolated thrombocytopenia, and these are the proteins which are useful in the process of this clotting in PT and PTT. Therefore, the PT and PTT both, this is an important point, both are normal in isolated thrombocytopenia. Therefore, the option C and D, one of them would be true. The next thing is we would see if the spleen size is normal or the spleen size is increased in immunothrombocytopenia. What happens is the spleen size, the spleen size is normal in ITP. In ITP, the splenic sinusoids are congested. These are congested, and the follicular cells are enlarged. Reactive germinal center is also affected in the spleen. But the thing is, the spleen size is normal in ITP. Therefore, the answer is straightforward C, normal spleen size, normal PT, normal PTT. But the thing is, the treatment given here is rituximab. What is this rituximab? We can find this by thinking about treatment which should be given in thrombocytopenia ITP. By the looking at the mechanism, the pathogenesis of ITP, What we can do, what you should think that we can do, what we can do in platelet, IgG, phagocytes, these three things are present, what we can do to help the patient. The first thing we can do is by inhibiting these phagocytes. By inhibiting these phagocytes, we can suppress the function of them, and hence the destruction of platelet will be less. Therefore, the platelet count would not get much low, so that the spontaneous bleeding wouldn't occur. But how we can suppress the phagocytes is by immunosuppression. Simple. Immunosuppressive therapy. Immunosuppressive therapy. Like cyclosporin, steroids, etc. The thing which is helpful when immunosuppression is not used or is not helpful is the splenectomy. Splenectomy. We have seen that spleen size is normal, so how this splenectomy helps? It helps as we have seen the phagocytes are responsible for the destruction of platelets. So, splenectomy improves the condition of ITP. This shows that the phagocytes in spleen are majorly responsible for the destruction of the platelets. Therefore, the phagocytes in spleen are mostly responsible for the water destruction. Therefore, the removal of spleen will improve the condition of the patient of ITP. Therefore, splenectomy is a treatment for chronic ITP. What if this also not works? What if this also fails? The next treatment we will find again in the pathogenesis part. What we can do last is we can inhibit this IgG. We can inhibit the opsonization by IgG so that destruction of platelets is suppressed or inhibited. We can do this. We can do this by giving a drug, given a drug which can act against against the antibodies like of IgG antibodies, that is IgG, by or given a drug which can bind or an attack a protein of IgG. The drug here used is rituximab. It is a anti CD20 antibody. It is an antibody, monoclonal antibody. It acts against the CD20 protein. What is CD20 protein? This is a protein found in IgG. See this CD20. The CD20 protein is found in the IgG molecule, and this rituximab work against or inhibit the work against this and destroys the CD20 molecule. Therefore, rituximab is helpful in ITP because it inhibits the IgG molecule and therefore inhibits the opsonization. Rituximab. And therefore, the answer to this question would be normal PT, normal PTT, normal spleen size, and rituximab. The answer is C. Normal prothrombin time, normal partial thromboplastin time, normal spleen, and rituximab.